Hi everybody, welcome to question and answer again here at New Grad Bootcamp. So I was given another question earlier on. It said how to navigate failure and what to do regarding non-responsive patients. And that's a great question, absolutely brilliant question, because obviously when you're a new graduate and you just started and your confidence is not quite there yet, it can be tough when patients just stop coming in. You know, when they're just not doing what you want them to do. They're not responding to your care the way you hope they would, or even they hope they would. So where's the problem? And I mean, that kind of thing, that can if it keeps happening, it can kind of erode your confidence even further. So how to navigate failure? I mean, that is something that you kind of have to understand what the word failure actually means. And is that failure on your behalf, or is that on their behalf? And I don't mean you got to go and point fingers here and telling the patients, no, it was your fault, you failed. You know, not me, I was perfect. You know, but inside you may be thinking that. And instead of telling the patients that, you kind of just have to have the inner confidence and comfort in the knowledge that you essentially did everything right. If you remember my previous little question and answer, it was all about understanding the patient and then providing options and then empowering the patient. So if you have done those three things to your best ability, the failure is not yours. It was simply a matter of non-matching chemistry perhaps between you and the patient. And you can't force free will. You don't have to. You should not ever force free will. You shouldn't be selling these things to patients. Sometimes the options you're giving are not appealing to patients. Simple. It's just not right for them. Maybe not right now. Maybe it will be in the future. Maybe you are just not the right person for them. And that's cool. Hopefully they'll find someone else who is the right person, who gives them the right options, and who potentially tells them what they want to hear a bit more. But as long as you know in yourself you've done everything to your best ability, then there's no point in you worrying about it, taking it personally, this and that. You've done your bit, you rest easy, you've been a rock star, you've done everything right.